Hi, this is James, and I'm going to giving a report on examination of skills on how to examine a female genitalia. The first thing you want to do is to gather all your equipment uh, ready for the patient. Wash your hands, introduce yourself to the patient, explain to the patient what you're about to do. Once you do that, you place the patient in a lithotomy position, and you introduce yourself, you introduce the hand you're going to use, and explain to them how the touch is going to feel. Um, while covered, you can leave an area where you can communicate with the patient, and also you can see the patient's face and reaction. The first thing you want to do is to um, examine from the mons pubis. You want to inspect the skin, hair distribution. Um, you want to look for any redness, erythema, any discharge, any red, labia majora, labia minora, the clitoris, anus, all those areas you want to look, inspect for redness or erythema or any discharge. The next thing you want to do is to milk the skin's gland. Insert your lubricated finger and squeeze using your index and your middle index and your thumb, and then you want to also check, palpate the buckling gland for enlargement. So normally I did not feel any on mine, and they were not inflamed. The patient denies any. I did not see any discharge. The next thing you want to do is to insert the speculum, and you want to get it nice and warm. It lubricated with water, insert it at a 45-degree angle, and when you introduce it in the nutrators, um, go ahead and straighten it out and advance it as far deep into the vagina as you can. Then open it, open to reveal the cervix and to also reveal the os. You want to examine the for redness, you want to examine for masses, you want to examine for any discharge. As you do that, you can also examine the vaginal walls. If there is any specimen to be done, this is the time to do it. And then when you're comfortable, unlock it and pull it out gently um, while examining the vaginal walls as well. Once you do that, discard the glove. Tell the patient you're going to do a bimanual exam. You insert your index finger and your middle finger, and using downward motion with your non-dominant hand, you kind of you sweep the uterus. You feel the vaginal walls. You're feeling for masses. You're feeling for indurations. Um, and you feel the cervix for the same, for the redness, for masses, for and ask the patient whether they're uncomfortable. When you do that, you sweep downward from the ovaries down both left and right. Uh, you want to palpate the uterus, palpate the walls, make sure that there are no indurations, no masses that you can feel, and that everything is nice and even. Once you've done that, you can remove the glove, explain to the patient, um, and ask whether they have any questions for you, and that is the end of the exam. Thank you.